Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have peritoneal dialysis. Peritoneal dialysis is mainly of two types. One, we have continuous ambulatory peritoneal dialysis. This is called as CAPD, or we have APD. Then we have slow continuous ultrafiltration type of dialysis. This is slow continuous ultrafiltration type of dialysis. This is SCUF. So these are the two types of peritoneal dialysis. First, continuous ambulatory peritoneal dialysis. In continuous ambulatory peritoneal dialysis, here we put a permanent catheter is put into the peritoneum. It is put into the peritoneum. A permanent catheter is put into the peritoneum via a subcutaneous tunnel. So after putting a catheter, you will inject or infuse, or you will introduce almost 2 liters of the dialysate is introduced, and this is exchanged up to 5 times a day. It can be exchanged 5 times a day. Now the peritoneal membrane will itself acts like a filtration membrane. The peritoneal membrane will act like a filtration membrane. So peritoneal membrane will act like a filtration membrane. So as a result, all the electrolytes which are in excess quantities, or then urea and everything is filtered into the dialysate, so that the blood levels of all of them will become normal, and thus the complications will decrease. Now this continuous ambulatory peritoneal dialysis has some complications. The complications of continuous ambulatory peritoneal dialysis include: there can be peritonitis. This peritonitis usually occurs due to staphylococcus aureus or streptococcus, or it can occur due to coliforms. There can be catheter blockade can result in these complications, or the patient can have weight gain, and poor diabetic control can result in these complications, and even pleural effusion can result in them. So complications of chronic ambulatory peritoneal dialysis: because we are doing peritoneal dialysis, we are introducing the dialysate fluid into the peritoneal cavity. This can result in infection iatrogenically, which can cause peritonitis. Second, the catheter may become blocked. Third, there can be weight gain can be seen in the patient, and the patient might develop pleural effusion. Now the second type of dialysis is slow continuous ultrafiltration type of dialysis. So this slow continuous ultrafiltration type of dialysis is: here you will have to removal of water is done from the patient's blood. It is slow continuous ultrafiltration type of dialysis. It is mainly water removal. Okay, removal of water from the patient's blood is called as ultrafiltration. Okay, so here this is only the main important function of this is to remove the water. So it is only done to remove the water. It is not sufficient or not an efficient method to remove the wastes. So this slow continuous ultrafiltration type of dialysis does not require any it does not require any replacement fluid, and mainly the water removal or fluid removal here is almost 300 to 500 ml per hour is the fluid removal.
thank you and thank you for watching.